Good evening. Yes.
So good afternoon, dear students. So I welcome you to day 3. Good afternoon, students. So I heartily welcome all of you to day 3 afternoon session. Your health is in your hand. So before commencing this session, I would like to introduce our today's resource person, Dr. N.M. Shamsundar. So he is a professor of anatomy, JSS Medical College, Mysuru, ex-dean, Faculty of Biomedical Sciences, JSS University, Mysuru, working in JSS Medical College for about 34 years, and he served as HOD for 16 years. He is a family physician and practicing pediatric surgeon. So if you want to see the number of publications what sir has published, he has published over 40 plus articles in high impact factor professional journals, and he is member for various esteemed organizations for more than 20 national and international organizations, several universities, prestigious membership MISP, member of International Society for Plastination, Brisbane, Australia. So let us see few career highlights of Dr. N.M. Shamsundar sir. He has established health museum for students as well as the general public at the Department of Anatomy, JSS Medical College, Mysuru. Established the first Plastination museum in India. Established the second Depression Brain Bank in the world for neuroscience research. Created the first Alzheimer's animal model to understand and design drugs. He also established an ear ossicles transplantation bank, a repository of ear bones taken from dead bodies for grafting to hearing impaired patients. He has so many awards and felicitations in his career. He has won Best Teacher Award at JSS Medical College, UGC CEC's Best Program for Teachers, National Award for Program on Plastination, first person to receive this award, Gold Medal for Research on Depression and Suicide from Karnataka Chapter of Anatomists, Indira Gandhi Gold Medal from Chennai, Bharat Jyoti Award from Indian International Friendship Society, Delhi, Lifetime Achievement Awards from Karnataka Samskrutika Parishat and Brahmarama Trust, Mysore, Best Science Communicator Award from Mysore Science Foundation, Samaja Seva Ratna and Vidya Ratna Award from several institutions. And he has also won the Best Paper Award at Regional Conference, PS Medical College, Kuppam, the Best Poster Presentation at Indo-US Conference. Pride of Mysore Award has been awarded to Sir by Pragati Parishatan, Mysore, Vishwamanava Award by Karnataka Samskrutika Parishat, Hoysala Award by Hoysala Sangha and Savigandhana Patrika Balaga, felicitations by Lions Club, Rotary Club and many schools and colleges, D.V. Gundappa Smaraka Award by Vipra Associations, Doctors Day Award by JSS Medical College, Rotary Club, Gravity Science Foundation. So he has so many felicitations and awards in his careers, and we are very proud to have him as our resource person for today's session, and I hope students make most of this session and learn new things that helps to keep their mind and body healthy. So I welcome you sir on behalf of the National Institute of Engineering, Mysuru family. Welcome you once again. Please take over the session sir.
Good afternoon friends. At the outset, let me thank your teacher, madam, for the nice introduction. The purpose of probably quite a long introduction is only to motivate my young friends so that they can also achieve something in their life. Like a small kingfisher which has become worldwide known and famous and popular. Let each one of you achieve something in your life and have a great future in the days to come. Wish you good afternoon. I hope you had a good sumptuous lunch, not so sumptuous probably to make you sleep after the lunch. We're always fascinated by things like this, the Eiffel Tower and the beautiful musical fountains around. We always wish we also should be as popular and as happy as that. It's me, Shyam Sundar. I'm a senior professor in the one of the best medical colleges in Karnataka. We happen to be in the top, not only in Karnataka, in India, in many situations where different medical colleges are assessed. Incidentally, I was also a dean, Faculty of Biomedical Sciences, which teaches other than medical profession in the JSS University. Incidentally, I'm also a family physician practicing pediatric surgery also. Probably you will find something interesting in my presentations. And last pink one is something very really interesting, which I want you to concentrate so that your life will be very happy. So these are the things which I would like to you to concentrate. I am a person with very high positive attitude. When I say this, I always feel it is a sunrise. Sun is rising, the day to come is going to be a great day. And I believe compared to yesterday, today should be a better day. Compared to today, tomorrow should be even a better day. So have that positive attitude always and try to achieve something in your life. First, for your own happiness. Second, to make others happy. The topic of today is your health is in your hands, not in somebody else's hand. Probably I assume that I am one of the few people who are going to address you, or maybe I am the only person as a medical person or a doctor who is going to address you during this induction program. Probably all the remaining people will be your teachers in engineering field. So it's a great honor to me to share my experiences in totally a different institution of engineering. So my own feedback in the previous years of my interaction is students were very happy about some of the motivational aspects which I shared. Hope this batch also will be benefited with my talk and some of the photographs and pictures which I am going to share with you. Even though I won't say that I am the person who has totally succeeded in my life or have been successful in there's nothing like a end of success, is a onward journey. To some extent, as you have listened to the biodata, I've been able to achieve something to at least my own satisfaction. This is exactly what I want each one of you to look into. Each step is a way to success. Plan that. When you get a success, enjoy that, not only yourself, share with your family and friends. That makes you motivated so that you can do better in the next steps to come. As I told you earlier, whatever you may be, whatever problems you have, keep it aside. Problems are there to teach us to be better. So have a positive attitude in every aspect. Most important thing is self-confidence. The confidence that you have about yourself, and say that I can do it. If I cannot do it, who else can do it? That should be your challenge. Anything and everything is possible. There is nothing impossible. And one of the great persons said, successful people do not do different things. You don't need to do something totally different nobody else has done, but do the same thing in a different way. That is the basic principle. My friends always say, if we were born maybe 500 years back, 1,000 years back, we could have done so many inventions, maybe discoveries. Now everything has been done, there is nothing to do. No, not at all. There are so many thousands and thousands of things yet to be done. So it's only a question of viewing the same thing from a different angle, doing the same thing in a different way. Always not only encourage your curriculum, but your extracurricular activities go a long way in your success. If you have the hobbies, please do continue. Every college has got cultural committees, cultural programs, college days and things like that. Even intercollegiate competitions. Always take part. Only study is not going to make you anything better. Along with the studies, you must also cultivate and encourage your other components of your habit or attitude which makes you a better person in your profession also. That also I'm going to share probably at the end. Always see that you are a special person. Successful people have two things they say. One is smile in their lips and silence in their mind. There's nothing to lose when you smile at somebody, greet somebody in the morning or evening. People always reciprocate, they feel happy. Why to have a grunting look or a angry look? And silence, when you find something is not going on all right, be silent, don't quarrel. So these are going to solve the problem. If it is there, a smile, and silence is going to avoid the problem. Unnecessary quarreling may not be of any help to neither you nor to the other person. So this is the basic principle of few things in your success. I told you, you try to be something very special. There are so many palaces in India and abroad, but once a person sees the Mysore palace, he can never forget, he always remember. When you go to another state, another country, when you say you are from Mysore, oh Mysore, I have seen Mysore palace or Vrindavan gardens, see what an icon. So you also try to achieve something by planning that you are a special person. Maybe I have done a few things probably which make me get invited to this college, even though I am not an engineer. I am a purely medical person, and surprisingly a few engineering hobbies which I will share with you. I have been invited many since years. So you try to be something special where people recognize you, they invite you, they share your experiences, then it makes you happy and go further. The same Mysore palace, seen in the evenings on festival days, holidays, looks gorgeous, wonderful. Nobody can forget this picture. It's a permanent image in your mind. So instead of being an ordinary student, a routine student, try to see that you achieve something in your life. This is my college, JSS Medical College, established about 35 years back. I am there since the beginning. I am proud of the college. Probably college and administration is also proud about me. So this type of a relationship you have to build up. You should be happy and proud about your family, your parents and other family members. You should be proud of your institutions, proud of your friends and other things, maybe your country too. So when you develop that attitude, you see that you are a person with lot of support, good support and positive support. Always dream big. This is what Dr. APJ Abdul Kalam used to say. Dream big. Don't dream of just getting a pass in your different semesters or getting a job after your B or whatever. No. You try to dream a very big dream. I should get the first rank in the first semester. I should become topper in my class. So when you dream big and simultaneously plan, definitely you will achieve it. You will be surprised. I never thought I will get a first rank. You have seen the students telling that. So it's not impossible. One thing is you have to plan. Just dreaming is not going to lead you anywhere. You have to plan for that. This is our hospital, JSS hospital. And again, a very proud situation is this happens to be the biggest or the largest hospital in India. It has got 1,800 beds. No other hospital in India is so big, including the All India Institute of Medical Sciences, Delhi. And we have got all specialties, routine treatments, super specialties, you name it, cardiac surgery, neurosurgery, you name it, everything is there. And you will probably be surprised that it must be a very expensive hospital because it's such a huge and all specialties, and it's probably a nice shocking information if I tell. You go to the outpatient department, pay just 50 rupees, 50, and register. You get a card and a folder. For full 1 year, 365 days, you will be given free outpatient treatment. Absolutely not even a single paisa out of that. You calculate. You can go to any number of specialists, super specialists, any department. You can go to skin department, you can go to medicine department, you can go to ENT, any department, any number of times throughout the year. You will not be charged extra also. Only if there is some investigation, you need admission, maybe some surgery, there are also minimum charges. So we have lots of patients, more than 2,000 patients attend every day, and villages nearby, they are so happy about our institution. So this is what exactly I am trying to tell you. You try to plan something, make it the best one, you automatically get recognized, you will come up in life and you will feel proud. At the same time, do not forget your family members or your friends. Try to help them out, motivate them, try to take them along with you. They will also be grateful to you. So JSS stands for Jagadguru Sri Shivarateshwara Mahavidyapita. This happens to be a religious institution headed by Swamiji, and in whole India, as a private organization, this has more than 350 institutions, both in India and abroad. You name it, you have it. Starting from kindergarten to all the schools, all degree colleges, including engineering, medical, dental, you name it. We have everything, more than 350. So, as a private organization, we are more than satisfied. And it is, as I told you, headed by our Swamiji, very encouraging person, very positive attitude. You can see the smile in his face. You also develop that attitude of a smile and being positive attitude. A lot of people surround you, a lot of people help you out when you have this positive attitude. Incidentally, as a medical person, I would like to share a very interesting technical aspect here in the smile. For each movement of any part, you need muscles. Even for smiling, movement of the face, movement of the eyes, movement of the mouth, you need movement of the different parts of the face. You'll be surprised, it takes only 3 to 4 muscles, contraction of 3 or 4 muscles to smile at another person. Whereas anger takes more muscles, more energy. So why you want to waste your energy? Why you want to be angry? Why you want to create a bad impression about yourself? So smile. Try to a smile even is going to decrease the anxiety and tension of another person. Speak to the other person. Try to share his unhappiness or problems. Then we'll say, thank you so much for your concern. By talking to you, I really got relaxed a little. Try to help him out. Definitely he will be grateful to you, and he will also come up with you. Stress is the most important thing that causes the disease. You name a simple thing like a headache, a cold and a cough, maybe a stomach ache or a gastritis, up to cancer, stress is a most important thing. Stress can be of so many factors which I am going to share with you, and reducing the stress is the most important component of management of stress. People live for 100 years, 120 years. You ask them, what is the secret? First thing probably they will say is, I am relaxed, I do not have stress, I do not bother about anything. Whatever is possible, I do it. Whatever can be repaired, I fix it. So stress is the most important thing. I told you, it can even lead to cancer. It can exaggerate the infections. It can increase the blood pressure. It can worsen the diabetes. So understand what could be the cause of stress in each situation. Try to solve it, try to manage it, stress comes down and the disease gets cured. And teamwork is important. Together each one achieves more than an individual. Whenever you have a team, you get confidence, people contribute their own share of the work, and definitely compared to one doing it, 4 people can do it in geometric proportions. This is my team. I am involved in a lot of research work of plastination, preservation of specimens, which I am going to show you some specimens. I am also involved in neuroscience, brain research. We are a very strong group of people involving not just doctors. In fact, in this team, hardly about 2 or 3 doctors are there. Majority are non-medical people. We have biochemistry people, we have neurobiochemistry people, we have computer science people, we have university people, we have non-medical people, all of them. But all of us share our experiences, learn from each other, teach each other. And you will believe me, this is a photograph more than could be 15 years back. And all those young looking boys and girls, they are all settled abroad, they are doing excellently. So a teamwork is going to make not in arithmetic proportions but in geometric proportions, helping each other. So try to build up a team, preferably with like-minded people. So a Sydney Bridge is always popular, and we always feel so nice and happy about the beautiful, healthy, small kids. So we always say childhood was such a great thing. Yes, even now, whatever age you belong to, even then that can be happy provided you plan and change your attitude. So this is the diagrammatic thing of a baby at the helm of getting delivered or discharged from the mother's home to this great world. So in this mother's home, it spent full 9 months in an air-conditioned chamber. Temperature was fixed, pressure was fixed, no botherations. It was used to get 24 hours nice oxygen, nutrients. It was kept nice, but once it comes out, it has to feel all the consequences of different types of pollution, people, and that. So this is the way of life. We don't need to be tensed up or bothered. We always say, yes, I'm ready to face it. I told you I'm incidentally a children's surgeon also. Things like this come. Most of the time when we see such things, the parents and the relatives get upset. Oh, what has gone wrong with my child? What was the problem? Did I do any papa? Nothing. It's a very small problem. Just like our machines go wrong, this wonderful living machine also can go wrong sometimes due to birth defects. But believe me, such operations are done in my clinic itself. Very small children are brought. I explain to them this is a very, very minor problem. It hardly takes 3 to 4 minutes to repair this. Just 3 to 4 minutes. I've done hundreds of them, and when they see the child next minute smiling and feeling relaxed, they say, yes, this is all. So you should have your own value by your knowledge and your skill, whatever field you may be, right? Incidentally, your teacher introduced me as I'm a physician, family physician, as well as a surgeon. This is my clinic. Coincidentally, yesterday I completed 36 years in this clinic, and today happens to be 37th year starting. And I have a small museum in my clinic also. Putting somebody's photograph or putting a TV or a channel. I believe people should be educated, particularly regarding the health. So when they sit outside my consultation chamber or when they are waiting for the operation or surgery to be over, they look into all these specimens. There are specimens of different organs, the heart or the kidney or the brain or things like that. There are also specimens of different diseases up to cancer. So they look into this, they get educated, and when I come out, they have half a dozen questions about each one of them. I educate them. So being a teacher, being a doctor, is my responsibility to motivate and educate people regarding the maintenance of a good health. So incidentally, just like my hospital, which charges minimum, in Mysore, very popular, I charge only 10 rupees, including the medicines. Since 36 years I've been doing that. Not that I want to make a name or popularize, nothing like that. I thought, for sake of money, absence of money, people should not stay away from medical treatment or availability of medical treatment. So immediately they should be able to come. 36 years back I started with 10 rupees only per day. Today also I do the same thing. So that people feel money is not the primary thing. It's a question of early consultation by a qualified doctor, getting treatment, they get cured. Lot of early cancers, they have come to my clinic. I have operated in my clinic itself. Even today, after 25-30 years, they are fine, they are healthy. They always feel early detection of any disease is 100% curable. But unfortunately, if they come late, it may be difficult for us to cure also. We always say that there are manufacturing defects, talking in your language, manufacturing defects. In this child, of the 5 fingers, 2 were supposed to separate out during the development, but unfortunately due to so many factors they have not separated. This is a very simple problem. We give a local anesthesia, the fingers become totally numb, the child doesn't feel the pain at all. separate them, stitch them. It hardly takes about 12 to 13 minutes for repair. And I still remember one of the child which had a 6th finger, not this one, 6th finger, was looking at the surgery. It was a very small child, hardly about 2 years. It was very interesting for me also. It was watching. I was anxious what it would understand. So it was looking that one more finger is there. It is dangling around. I was giving injection. It didn't feel the pain because injection was given in such a small needle. It didn't feel the pain. And I was doing surgery, and it was looking at my face, looking at the finger. What is this fellow doing? When I took it out and gave it to the child, the other hand, it just smiled at me. What is it? You have cut it off. So early diagnosis, early intervention is going to make even the complicated like things better. So the reason why I am trying to share all these things is be aware of your health, because we know the proverb, if money is lost, nothing is lost. If health is lost, something definitely is lost. So health is more important. Health, you're going to lose money, you're going to lose confidence, you're going to lose the opportunity to do something, suffering more than that, and anxieties. So prevention is the only thing, cheapest thing, simplest thing regarding the health. So awareness about health is extremely important. So as I told you, this is my clinic. There are few people waiting for my consultation. I also do surgeries in my clinic as well as in my friend's hospital. In the little major surgeries I do, of course the charges are very minimum. For me, why I charge less is a learning process. Even complicated surgeries I can learn by doing on a patient. So patient is benefited with a treatment, surgical treatment. I get benefited by experience I get with each surgery. We get children like this. The mouth is become large. The speech can be altered, and it looks awkward also. One side mouth is larger. So it's a very simple surgery. We trim the edges, we take the measurements, make the mouth symmetrical, and the child becomes totally alright. There are also children born with a large head, liquid or fluid filled up inside the brain, outside the brain. It is a dangerous situation. At the earliest, when the baby is a few months old, or maybe a few weeks old sometimes, we try to bypass that, channelize that extra fluid around the brain, within the brain, cerebrospinal fluid, into the chest or the abdomen. Once the fluid is drained, the brain grows normally and the child survives. Otherwise, it is going to die within few days. All these surgical managements are very interesting. Some children are born with some tumor on the back, and we operate and correct it. And this girl looks so smart, looks perfectly alright, right? But unfortunately, when you understand the situation of this particular child, is very unfortunate. Looks beautiful, looks smiling, otherwise looks alright, but this could be some 5 or 6 years old girl, but the intelligence is hardly about 5 or 6 months. It cannot spell out mama, papa, it cannot say ABCD, it cannot even brush the teeth, it cannot take bath. There is a brain damage due to genetic problem. We call this as a Down syndrome, very difficult to manage. There are so many other associated problems like the heart problems, hearing problems, sight problems, bones and muscle problems. So we manage one by one and try to train the child, but it can never become perfectly normal like other children. There is a brain damage, IQ is severely affected, and it may not be able to go to normal adulthood. So we have to train not only the child but also the parents how to take care. This is a twins. One of my students was holding this specially prepared twins in the laboratory. This is some 30-year-old specimen. That means the girl who was probably 18 or 19 years old could be reaching 50 years by now. So such things we see. All these very awkward looking situations we have to manage, we have to understand. So all these can be managed, all these can be controlled. Some of them can be operated and corrected also. But our understanding, yes. My department is like mechanical engineering of your college. In the mechanical engineering, understand that they teach the structure of a machine, different types of machines. Here in my department of anatomy, we teach structure of one of the great wonderful machines, that is the human body, is a living machine. Students, maybe 15 to 20 maximum, stand around a table, and on the table what you see is a dead body. Yes, from the dead body we teach the structure of the body inside. To become a doctor and an efficient doctor and a surgeon, the student has to know right from the day one structure of every part. Every part has got a name, every muscle, every bone, every organ has a name. Everything we teach in one full year, and in the examination we expect them to answer all the questions. Only then they go to the second year. Second year onwards we teach the different diseases and the living people, patients. So the medical students are literally very seriously involved in learning right from the day one. And we got a very wonderful museum, one of the best museums in India, with hundreds of specimens. They are like spare parts of the human body. We got every organ like brain, the lungs, the heart, the liver, intestines, kidneys, uterus and whatnot. And we have opened some of the organs. We also kept some of the common diseases including cancer. Almost every college, every school students come in batches. We take them around like a tour. We explain the different organs, their functions, everything. Some introduction when they are interested to know about the diseases also. So we teach all these things. Except for this short period of 7-8 months due to Corona or COVID, we are not allowing the students. Once it gets controlled, we invite the students from different schools. It takes about 2 hours for the whole museum to be looked around. And small groups, absolutely there is no problem. You want to visit my college with your family members or a few of your classmates, you are most welcome. 9 to 4 we work. But a big group of 50 people, 60 people, some formality that we have to give permission. So things like that are always there in the museum. We explain each situation why these babies die, because later you graduate, you do post-graduation, you do fellowships and whatnot, then you get married. You don't want to have things like children like this, abnormal children like this. So educative knowledge about this, why it happened, is necessary to prevent such things from happening in our own family. So all these things are manufacturing defects. They die due to so many causes, and we can analyze the causes and share with all of you. As I told you, a lot of children, not only from the city, even from the villages they come, and we take them around. Myself and we have got 1 dozen colleagues. Incidentally, most of them are my students, either at UG level or PG level. So whoever is free, they take around the whole museum. We have more than 400 specimens, charts, models, photographs, everything. We educate these high school children regarding the health, and surprising thing is a health education. And after some years, they may get motivated to take up medical profession. Incidentally, about 3 years back, first MBBS student after the induction program came to my chamber and said, "Sir, can I speak to you?" "Yes, very much. Tell me, what is the great news?" He said, "About 4 years back when I was in high school, I had come to visit your museum. You had taken me around along with my parents and a friend. On that day itself I decided I must work hard, I must study very well, I must also become a doctor. So today I am so happy, sir, that the motivation you had given, the way you explained, really motivated me, and I got the MBBS seat in the same college. I came here to thank you for that encouragement." So such things do happen. So we are involved in a lot of research activities of different types of diseases. And special thing about me, why I am little recognized compared to other doctors in my college. We have about 400 plus doctors in our college, belonging to different departments, specialties and all that. I am one of the few recognized and special staff in my college, being the unique technique of preservation of specimens. When you saw the museum, you saw the bottles, glass or plastic bottles. There are specimens, babies, different organs inside the bottle to prevent them from putrefying, giving a bad smell, getting damaged. We preserve in a special liquid known as formalin. Formalin is nothing but formaldehyde gas dissolved in water. So that formalin preserves the specimens for any length of time, hundreds of years. So thing is, I cannot touch that specimen. Is a little irritating smell is there, and hands become a little rough after a long time handling. So I wanted to touch the specimen. I want to see how the lung feels, how the heart feels, how does the brain feel, are they hard, soft. So I had a dream right from the high school days. Can I not make a way of preservation in which there is no formalin, no irritation of formalin, no liquid, no glass also, no chamber also, no glass jar also? Can it not be kept on the table? The real one, not a plastic or fiberglass model. Real one, can we not have it on a table? Can I not cut it open and look into the interior? That was my dream when I was in the high school. After many experimentation, in the beginning a lot of specimens got spoiled. I used starting from kerosene to petrol, and you laugh at all the chemicals that they used, including the common salt which is used for preservation of a pickle. Finally, about 25 or 28 years, I came to a very interesting stage where I used polymers. Polymer science itself is a huge department in your engineering college, and many types of polymers I have used. Some of them are hard, some of them are soft, some of them are spongy, some of them are opaque, transparent. All of them I just could get educated from my colleagues in the engineering college, and I've used many of these polymers. So when I use polymers, replacing the water and fat which is present in the tissues, this is the most important principle of plastination. Plastination, because plastics are used or polymers are used instead of a watery or fatty solvent. So the principle here is remove the water, remove the fat from the tissues, organs. A 50-year-old person will have 60 to 70% water, 30 liters of water we have. A 50-year-old, 50 kg person. A 100 kg person will have 60 to 65 liters of water, quite a bit. And about 10 to 15, depending upon the personality or fattiness, 10 to 15% of fat. And these are the two which support the bacteria, virus, fungus and all that. So I thought, if you can remove the water, if you can remove the fat from the different organs and tissues and replace with resins or plastics, bacteria cannot survive in a plastic environment. Fungus and viruses cannot survive. So the specimen will be permanent. No question of any further processing. There is no need for a bottle. There is no need for formalin. It is dry. You can put it into your pocket, go to the class or conference. That's what I do. So incidentally, my thinking, my dream became true about 25 or 26 years back. I completed this, of course, still going on. Even today I am doing PhD on this plastination techniques using newer chemicals, newer polymers. And incidentally, I am happy and proud to share with you, I am the only person in India doing this technique, and I am the second person in the world. I have a similar friend from Germany, Heidelberg. He is also Professor HOD of Anatomy like me in a medical college in Heidelberg, Germany. He was the first person, started in 1980s. Maybe I started a little more than 10 years later. But my technique uses ordinary locally available resins which are very cheap. Gunther Warnagas is the first person in Germany. He uses very expensive chemicals. Of course, for Germany it may not be very expensive. For us it is. So he has got industry factory to prepare plastinated specimens. He exports to other countries and makes money. But in India we have no permission or right to prepare any specimens and sell it. Human organs cannot be sold. So anyway, I am the second person in the world. So I established a museum, Plastination museum in my department. So this is the way. There are no bottles. All the specimens are real. Not only human organs, we can plastinate different animals, different plants. All of them can be done. I take in my briefcase maybe 50 specimens, scorpions, snakes, insects, whatnot. Go to the children's school, summer camps. I show them the real one. They can touch. That is the greatness. They can touch and have a touch and feel experience. Children are fascinated to touch a snake. Some children want to hold the scorpion in their hand. Things like that happen. So this is a touch and feel. Another specialty is even the blind people can get educated. That's why I named it as Braille Health Museum. So we have the blind literature also kept on the table. They so-called read that with their fingers, and they touch this specimen, they get educated. Regularly we get all these visually impaired. So a few words about our health. I start with the ear because you are hearing me. Hopefully the information I'm trying to pass it on to you is going to be useful. Imagine you could not hear at all. Maybe you can only see the PowerPoint or maybe video of my talk, and you cannot understand what I am talking. No sound. Yes, hearing is a very, very important communication that we need. Little loss of hearing, going near the person. What did you say? Looks very awkward, socially awkward. So why I have put this is sometimes we are negligent about our health. We are very careful about our scooter or a car. We are careful about our dress, maybe about our house and furnishings. But most of the time, many times I observe, we are negligent about our own health. Particularly we go to schools, offline classes. I point out at the girls or the women, saying that these are all very dangerous people. There will be a moment of silence. Why Shamsur is telling the women and girls are dangerous? I tell them they got weapon. Weapon? What is that? AK-47? No. They got a hairpin. They pull out the hairpin, try to put into the ear, try to clean it, so-called. Some itching is there, some pain is there. They try to keep it clean. There's some wax or dust. They try to clean. Or they got a safety pin. They take it out and try to clean it. Very, very dangerous. Even a swab, you have to be very careful because at the end of the tube in the ear, there is a very, very thin, extremely thin eardrum, what we call as tympanic membrane. It is so delicate, like the paper of a kite. It is so delicate. Little damage to that, you're going to lose the hearing, partially or completely. Inside there are very, very small bones which can get damaged because of bad handling. I tell them boys are a little better. They don't have any of these safety pins and hairpins and all that. They only have a pen. It won't go inside the ear. So in that way, be careful about your hearing. People try to avoid you. They make bad comments about your hearing. So hearing and sight are extremely important sensations that we need to maintain, right? So passing on to the next one, this is a plastinated inner ear. What you see on the left side, the white ones are very, very small, very delicate. They are only few millimeters. They vibrate with sound. They convey these vibrations from the eardrum, from the external ear, middle ear, into the inner ear. Inner ear has got two components, the circle-like things known as the semicircular canals for balancing. On the left side there is a reddish one called the cochlea, looking like a snail shell, which is a transducer. You know, transducer is a instrument which can convert one form of energy into another form. So this inner ear cochlea is a transducer converting the physical vibrations of sound into electrical signals which pass through the nerve to the brain to understand what is the sound coming out. So these are very delicate things. Damage to ear can result in hearing loss, giddiness, because of the inner ear is made up of semicircular canals which are involved in balance. So we have a ear-ossical bank in our hospital. From the dead body, the small bones are taken out using a small surgery, quick surgery. These are sterilized. Bacteria, viruses are not there. These are sterilized. They are kept at -80 degrees. They can be transplanted to another person, living person. Even though we have gold, Teflon, plastic pistons replacing these small bones, but nothing like a real one. So we take it out from the dead body, sterilize it and store it -80 degrees centigrade. Whenever there is a patient who needs this damaged, very, very minute bones, we can transplant. So in India, very few people are doing this. So our ENT department is doing this. We collect it from dead bodies. And one of the most important organ, if you ask me, is the heart. Heart is the muscular pump, and here I always make a joke, particularly when I go to high schools and junior colleges. I think you are mature enough. I don't need to say much about things. But when you go to high school, very, very dangerous adolescent period of boys and girls, I tell them, the boys sitting there are all dangerous fellows, don't believe them. The girls yell and say, oh, very nice, Shamsar has been supporting us. Do you know why? And every day in the TV or the news or papers, we say the boy and the girl somehow try to know each other, they encounter, they become friends. Friendship turns out to be making them as lovers, and further goes saying that I'm going to marry you. All those things happen. If things go on very well, fine, excellent, everybody is happy. But unfortunately, many situations it doesn't. In that heat of beginning affection, things go on, but something goes wrong. It leads to complications. And these bloody boys make a great statement. What do they tell the girl? They tell, I love you from the bottom of the heart. Most wrong situation or wrong statement. I show them, because this online class I'm unable to show you. I can only show you the real heart or a plastinated heart. When I go to offline this thing, I give the heart prepared by Plastination to their hand. There is absolutely no love or affection or hatred or anything in the heart. This is purely a muscle, 200 to 250 grams of muscle which contracts automatically as well as by control of the brain. There is no love, there is no hatred, anything at all. So if the boy says, I love you from the bottom of the heart, whether top or bottom, there is no love. Tell them that I don't believe you, because already I know what is heart. So such situations can come. So we should know the real situation of this special organ. This is a plastinated heart. You can touch the heart, you can see the interior of the heart. It's purely a muscle, 99.9% is the muscle with some coverings. It does work 24 hours a day. Whether you are awake, you are in the class, you are moving around, you are sleeping, it just works 24 hours a day without a break almost. And if you take care of the heart, prevent the insult to the heart, maintaining a good physical exercises, and most important, good diet and food. Believe me, the heart can function for more than 100 years. You can live for 100 years. A lot of people live for 100 years. Only when you insult by bad food, junk food, other complications of diabetes, hypertension, the heart naturally is after is a pump. When you take care of your pump in the house from some tank to the overhead tank, it works for years together. So similarly, the heart is one of the most important organs which pumps the blood throughout the body for circulation of blood after is a transport system, and to supply oxygen and nutrients to different parts of the body and bring back carbon dioxide and waste materials for disposable. It can live for 100 years, you can live for 100 years, but unfortunately we insult that. And any damages to this, excessive junk food, most important thing is junk food. All those chemicals which are eaten along with junk food damage not only the heart, they damage the kidney, they damage the eyes, brain, muscles, whatnot. So be very careful about your diet and you can be healthy, you can live longer. And once the heart stops, the person is going to die, because there is the one which supplies oxygen and nutrients to every part of the body. If the brain part of it can be dead, still the person can be alive. We say brain dead. Particularly when the brain which controls the heart and the respiration are working, still the person can be alive and he can still be doing some respiration and heart can be functioning. And we have seen the transplants of different organs when the brain is dead and it can never come back to life, certified by qualified people. Different organs are taken out from this brain dead person, like the heart, the lungs, the pancreas, the liver, the kidneys, the muscle, the bone, whatnot. Nearly a dozen organs are harvested, transplanted to the needy patients elsewhere in different hospitals. You have seen the green corridor being transported by ambulance, even by flight. So all these are possible. So heart is the most important, because without working with the heart, there is no life. Even brain may not be so important, because part of the brain dead, still the person can be alive. So taking care of the heart is important. We'll come back to brain little later. These are the two lungs present inside the chest, beautiful organs trying to supply oxygen from the atmospheric air to the blood and taking out the carbon dioxide. That means it is a place of exchange of oxygen and carbon dioxide. And unfortunately, due to so many reasons, every day we see that the atmospheric air is being polluted and highly polluted. Only yesterday I was looking into the news saying that Delhi has got a maximum pollution. People are dying because of the pollution. Breathe the polluted air. Air contains so many chemicals, both gaseous, volatile as well as suspended chemicals, bacteria, viruses, fungus, different chemicals as vapors, and once they enter they only can go to the lungs. From there through the blood they can go to every part of the body. In fact, we used to say that heart attack is the commonest cause of death, but unfortunately heart attack has taken second point. Stoppage of heart is heart attack. It has taken the second place. First place, unfortunately nowadays, is the infection of the lungs, bronchitis, allergy bronchitis, including our COVID. So lungs are beautifully pale pink or whitish colored organs which allow air to enter and come out, and exchange of very important element of oxygen and carbon dioxide. Because of the air pollution, the lungs are being damaged, and you see that lungs are getting deposit of carbon particles, dust particles, and over that we create our own problem. Paying money. What is that? Paying money, creating a problem, inviting the problem. Smoking. Every cigarette is supposed to take away 15 minutes of your precious life. So you can calculate, if somebody is a smoker, smokes 100 cigarettes, 100 into 15 minutes, so many hours. So he is going to die earlier. The tobacco contains more than 100 dangerous, deadly, cancer-producing, carcinogenic alkaloids or chemicals. When they go to the lungs, they damage the lungs. In men and who are exposed to this smoking, even men and girls have started smoking unfortunately nowadays. Number one cancer is lung cancer. Smoke can reach the different parts of the body through blood. Stomach cancer is again very common in smokers. Liver cancer is very common in smokers. Women also. So if by chance any of you or your friends and relatives are smokers, please convey the message. Smoking is nothing but inhaling the poison, inhaling the cancer chemical. You are counting down your life day by day or hour by hour. So never get involved with either air pollution or smoking. Lungs are spongy, beautiful organs meant for exchange of gases. It looks like a tree, inverted tree, and every fraction of a millimeter there is exchange of oxygen. There are 10 lakh, 1 million alveoli. Alveoli is a place, small balloon-like place where exchange takes place. Within hardly 3 seconds, 1 second for taking in air, breathing in, inspiration, another frankly less than a second for exchange of oxygen, carbon dioxide, and another second for leaving the carbon dioxide filled air during expiration. So this beautiful lung has to be maintained if you want to be healthy regarding your lungs as well as other parts of the body to live longer. You can see the normal lung, whitish colored, 2 lungs, beautiful and healthy, whereas on your right side you can see the dark brown lung with deposits of carbon particles, dust particles, other suspended particles, including the different chemicals present in the smoke. The person is going to count down the days. He is going to die of cancer, bronchitis and cancer. Abdomen is a Pandora's box. On the left top you can see the purplish liver, a great organ meant for processing. It is a food processor in a way. Whatever food we take from the stomach, from the intestines, small and large intestines, through the blood they reach the liver. In the liver, processing of all types of food takes place, breaking down into smaller particles or molecules and sending it to different parts for growth and development, for production of blood components, for production of immune system, to detoxify if there are dangerous chemicals. Waste things are sent through the urine to the outside. A great gland, 1.5 kg organ is the liver. Unfortunately, our friends, I always call them as Tirthankararu. Don't think of the Tirthankararu of South Canada, no, they are great. We should salute them. My Tirthankaruru are people in the evening going to the bar and having their own fun time. Every drop of alcohol is going to damage and kill thousands of liver cells. Believe me, I've been treating people with this liver problem. So every drop of alcohol, whatever grade, imported, Indian, nothing, alcohol is alcohol. So it's going to kill or damage liver cells. Day by day, the liver cell number comes down, and one unfortunate day, the liver undergoes cirrhosis, replaced by fibrous tissue. It can no longer function. The components present in the blood become jaundiced, yellow pigment develops, the liver itself shrinks, goes for cirrhosis, and the next stage is only cancer and death. So liver cancer is very common in alcoholics and smokers. So it is your duty as a educated person to motivate and educate regarding the ill health or ill effects of smoking and alcohol. Of course, it includes junk food also, which contain a lot of chemicals. So in this diagram we see the intestine, your food department. In our local language Kannada, I don't know how many of you can understand Kannada, I can translate. ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ. If you know your food, your diet properly, you will never get any disease. If you are controlled in your diet, you will always be happy. A good balanced diet, nice breakfast in the morning to take care of your morning activities till the lunch time. A good lunch in the afternoon between maybe 1 and 2 or 1 and 3 to take care of your energy requirements till the dinner time, maybe 8:30, 9:30, and a simple dinner to take care of the activities and repair work at night till next morning breakfast. So a planned, balanced diet, you're going to live longer, and that is one of the secrets of a good, healthy life. So you should know what you're eating, how much you're eating. Totally avoid junk food, roadside food. It contains all types of bacteria, viruses, dust from the road as the lorries and buses, cars pass. The rust is raised and it lands up in your plate or whatever other things. Never eat if you are bothered about your health and your longevity of life. Have food in a hotel which is hygienic. Still better, have food from your own family members or in the hostel, wherever you are. A clean, hygienic food. It keeps you healthy. Why to spoil your health, paying money to the food, then pay money to the doctors in the hospital to repair it. So it's always better to prevent it. So liver is in large one, the brownish one. Behind that, in the background, in the shade, you see another organ looking like a comet. Near the lower part, there is a pancreas which produces insulin. That is the one which is very important to produce insulin, taking care of the sugar or a carbohydrate balance in our body. If there is a damage to this, infection, bacteria, virus, chemical damages to this pancreas, insulin production may be decreased and the person lands up in diabetes. Very unfortunately, we used to think that diabetes is a elderly people's problem, but unfortunately now we see that diabetes is seen even at children's age, primary type 1 diabetes. Youngsters, 20 years, 25 years, 15 years, we see diabetes purely because there is a damage to pancreas, insulin production is decreased and their food habits are bad. Infection by viruses can cause diabetes. So if you are a little careful about your hygiene, healthcare, things will be there. Urinary system is our system which takes care of the housekeeping of our body. Just as your house is clean because of the housekeeping people or your own self, our body produces a lot of chemicals which are dangerous, and every second the two kidneys present in the deep part of the abdomen, middle of the abdomen, they filter the blood, they take out all those chemicals and poisonous chemicals, everything, filter it out and make a urine. So continuous filtering, and your input of water should be more. An average, an adult should drink 1.5 to 2 liters of water. Irrespective of it's summer or winter, you need a lot of water because the water is the one which brings out the poisonous chemicals from the blood and produces urine. So more water is always safer, and any chemicals you ingest, junk food I told you, or any poisonous chemicals you ingest along with the food. Nowadays in the villages you see the plants and flowers and fruits being sprayed with different types of insecticide. They are all poisonous chemicals. If you use the food without proper washing, without cleaning, all this poisonous food can enter into your system, and kidneys have to literally filter them out. In this bargain, kidney can get damaged, so kidney infection can be there, kidney failure can be there, kidney cancers are becoming common because of the poisonous chemical that we ingest or take food along with the food. So if you take care of the kidney, kidney keeps your whole system clean. So it's a housekeeping system. So the kidney of the size of a small old style mobile, bean shaped. It keeps the body 24 hours a day, it works. It keeps the whole body clean of chemical. Yes, another thing for our girlfriends or the girl students, the uterus. Very unfortunate thing is, because of the lifestyle, because of the stresses, because of the food habits, pollutions, both the water pollution, food pollution, air pollution, this uterus, which is present only in women, which is necessary for taking care of the pregnancy and childbirth, uterine cancer is unfortunately increasing because of the environment, because of the viral infections, bacterial infections of uterus, chemical damages. Uterine cancers, breast cancer, uterine cancer are number one in women. So your hygiene, cleanliness and food habits have to be taken care if you want to be careful about, or if you want to avoid uterine cancers. They are the number one cancers. In our body we have more than 200 bones, making up is a framework, skeletal framework, which gives support, helps in movement, mobility, muscle attachments, different functions, protections, strength. And we know every day we see in the papers and the news, the youngsters, boys like you, going in two-wheelers, high speed, doing all the circus, landing up in accidents, broken bones. It takes 2 months, 2.5 months for the original bones to heal up. But believe me, it is a repaired bone, nothing like a original. So be careful about your driving, about the workplace. Something can fall on you and get injured. So all these bones are so important, not only to give protection, but also they are the factory for blood production. Inside the bone there is a bone marrow, which is the factory for production of all the components of blood. It contains calcium, is a calcium bank also. It supplies calcium whenever needed. So there are muscles, hundreds of muscles helping in the movement of different parts of the body, contraction of the heart, movement of different parts, everything. So muscle is a very important issue. A good nutritious food, good healthy exercises makes the muscle in a good condition. Other tissues may wear and tear happen. Our shoe gets worn out after some years, after some months, whereas muscle is the one which improves on usage. Nervous tissue is the one which improves on usage. So because of the nutritional deficiency, less protein, bad chemicals along with the food, muscles are getting damaged, muscles are becoming weaker. People say, I cannot walk, I am feeling the muscle cramps. So all these due to food habits, bad food habits. So improve that by good exercise and good food. Next thing which improves by usage is nervous system, the brain and the spinal cord. More and more work you give, physical work like sports, like gymnastic and anything else, the muscles improve. Similarly, the neurobics give exercise to the brain, different tasks, repeatability, studies, discussions, brain is going to improve. So something goes wrong, this is the brain, a model of a brain. Brain gets damaged, we have a lot of diseases, from infections to birth defects, including cancer of the brain. My friend in the neurosurgery department, my own classmate, he operates almost 1 to 2 brain cancers every week. Unfortunately, because of the contaminated food, viral infections, brain cancers are increasing. Any headache, any slight disturbance in the head, immediately go to a doctor. And nowadays we got a lot of very good equipments where we can test the brain, like a scanning, so the X-ray or a CT MRI scan, where we can make out the tumor inside. If operated at the earliest stage, the brain cancer is 100% curable. But if it's already damaging the brain, spread to other parts of the brain, it is impossible to make him survive. And functional aspect of the brain, we have depressions. Depression is a situation where the person becomes inactive, he is not interested in doing anything, he loses hope, he loses, there is no life in me, why should I be alive at all these things. But unfortunately, due to so many reasons, depression is increasing throughout the world at all different age groups. Somebody commented, the children go for depression, the wife or husband goes for depression. They lose something, they go for depression. A lot of things are there, but interesting thing is depression is 100% curable at any stage rather, earlier the better. So we have the Department of Psychiatry where my colleagues examine the person, try to find out the cause of depression, motivate the fellow, educate that person. We have a lot of very good medicines or drugs. Within a few weeks or a few months, the person becomes totally alright. I have seen my own patients who were totally depressed, short of committing suicide. There is no meaning in living. Those people were treated, counseled, drugs were given. Now they say, I really do not know what had happened to me. I was about to commit suicide, and you gave me a nice instruction to go for a counseling and drugs. Now I am totally alright. I do not have any intention of suicide. I think I am going to educate people and motivate others also who are in depression. So we did a lot of research work on brain regarding depressions, taking over the brain of people who died of depression and committed suicide. We came out with very good results in the brain itself. So we have a lot of drugs which can alter those things, and we have a depression brain bag. This is the second in the world. First one is in Netherlands, second one is in JSS. We got a lot of funds also from DSE, DBT, and we worked at the brains. We tried to find out. We are treating in our hospital. A lot of depression patients becomes totally alright. I was involved in a model, animal model for example. We want to try a new drug. We cannot do it on the human being or the man directly. We have to do animal experiments. So I designed a rabbit. This again first time in the world. I got a national award for this, international award rather, Indo-American. So we created a rabbit, Alzheimer's disease, all the features, the behavior, the biochemical things, the habits, the food habits, everything. Then we gave medicines. It delayed the Alzheimer's disease, some of them prevented also. So people used our model to work on the Alzheimer's as well as the new drugs for Alzheimer's. So a lot of diseases are curable nowadays. So this aluminum mortate which are used for creating the Alzheimer's disease. Let's go to eye donation. Eye is a very important organ. Without eyes you can know that soul life is totally dark and nothing can be done. So take care of the eyes. Injuries to the eyes, viral bacterial infections, cancer for the eyes are unfortunately increasing in childhood days, adult also. So eye is one organ. The front of the eye, the glass, like the watch glass, can be taken out even after 6 hours after death and transplanted to another person. We have a eye bank, and I go to their house, take out this eye, give it to the hospital. They call the people who have got a corneal blindness, they transplant. By tomorrow morning he can see the wonderful, beautiful world. So eye donations are carried out by us. You can see that there is a cataract. It has to be operated and removed. The lens has become cloudy in color. Once it is removed, the person gets a full. See this is a small child which we had operated. This is more than 38 or 39 years back when I was doing children's surgery training. So the retinoblastoma is a cancer of a child which is hardly about 3.5 years in the children's hospital, a village child. It was so difficult for me to convince the parents saying that the child has got cancer, such a small child. So I convinced them, and they were reluctantly, hesitantly agreed for the surgery. I told them, if you do not get operated by now, it will spread to the other eye. Other eye which is normal now will become blind, and from this it can go to the brain also. The child is going to die. We educated them, motivated them. Finally it was operated. Child became totally alright. Of course I could not follow it up after 5 years, 10 years. It should be fine. So regarding the food, we should be very careful. Right from the childhood days, we give food, whatever the child wants. It becomes stubborn, it cries. We don't. Right from childhood days, try to educate the children regarding the ill effects of food. See, the obesity, it must not be more than 5 to 6 years old. It is definitely more than 50 kgs, exceeding my weight. And this childhood obesity is going to cause a lot of childhood diseases continue to the adulthood. Adult, there is no way. See, the person is more than 100 kgs. Women are no way inferior. So obesity is an invitation to so many diseases like diabetes, like the hypertension, cardiac problems, kidney problems, overweight, joint problems, muscular problems, and all these people can die early if not controlled. So food habits, see the McDonald's, the fellow is not even watching what he is eating, go on continuously eating, watching some TV or some program. So lot of organs, endocrine organs in the body which have to be taken care of. See, so many people have got this thyroid with the neck, and if neglected after many years, this can go for a cancer. So earlier stages it can be operated and the person becomes totally alright. See this lady, the tumor is bigger than the head itself. So all these are curable. The thing is, we have to educate people. So there is a pancreas I told you earlier which produces insulin. Deficiency of insulin produces diabetes. But it can be controlled, it can be treated, provided they come earlier. See this is a boy, very unfortunately has developed the breast like a female. So it's a hormonal imbalance, and I operate such boys, a lot of them. I explain to them saying that breast is not supposed to be present in men or the boys, it is dangerous, and more than that, breast development in the male leads to cancer, male breast cancer. So immediately get a few tests done, operate and remove it, they become totally alright, 100% alright. So I told you about plastination is similar to mummification. A few photographs I'm going to share with you. This is a 9 months old mummy, a newborn baby. So this is the art of dry preservation of specimens. No bottles, no foam, no smell, no fungus, no bacteria. One can take it in a cover or in a pocket. So new technique of preservation of biological specimens. They are all dry, they are colorful, like natural color, they are no smell, they are portable, no irritation of chemicals, they are inexpensive. So I've gone to many colleges, not only medical colleges, other institutions also give a talk and do demonstration and workshops. This is a real human heart plastinated. You can hold it in the hand, cut it open, see the interior, everything. So this is the cast of the lungs, how the beautiful lungs inside is the interior there. There is a silicone cast, how the air goes every second. So this is a plant can be plastinated. You can study the rare plants, medicinal plants for research. And I got the gold medal for such activities. I'm a member of International Society for Plastination, and our video, hardly about 11 minutes 12 seconds, got the national award for our team. And this is the topic, Plastination, art of immortalizing. It was a UGC program, national award, we got it. And it was a prestige and honor for me to appear on the cover page of a very popular magazine in Karnataka, Taranga, along with the baby I have plastinated. So I became popular with these things. The whole body can be plastinated. You can see that these 3 bodies are dead people, they have been plastinated just to create a image that they can be as good as alive. Even the animals can be plastinated, a scorpion. I go to schools to educate the children regarding the ill effects or dangers of these dangerous animals, of snakes and scorpions. We get a lot of VVIPs to our department of the college, Abdul Kalam and our Swamiji, you can see them. So I do this plastination of different organs, the tumors. You would have read in the paper saying that 50 kg tumor, 100 kg tumor was operated. Yes, there's the one on the left top. I showed you the plastination medium. This is the ovarian cyst and can become cancerous if neglected. We have a body donation association in 95 established, and I am the secretary since then. This is a minister who honored me on the day of inauguration, and he himself pledged the body. About 10 years back or so, he died, D.T. Jaikumar. His body was also, as on today, we have highest registration in whole India. No other medical college has got so much of registration, more than 3,500 people. 421 bodies already have been donated to our college. We use it for teaching anatomy to students, medical, dental, nursing, physiotherapy students. We use these bodies for research, to train the young doctors for surgery. All these things we use. There is no age limit for donations. In elderly, more than 100, I'm sure. A lot of people donate their bodies. We do plastination. This was a mathematics professor with a lot of other hobbies. You can be still alive after death. There is a message. Medical legal case like accident, murder and suicide, we do not take part in because they are police cases. There is no alternative for human bodies, and medical science is going to be benefited because in your computer science you can order for computer, you get it the next day. You want a machine, you can order, but where do you order a human body? I cannot. So we need a real human body. We depend on dead people. So there is no adequate substitute. So different organs can be transplanted, as I told you earlier. Eyes of cornea, kidney, skin, liver, heart, bones, so many organs. We use it for teaching, research, specimens, surgical training, exhibition, so on. Training we conduct in our department. And the secretary, I work almost 24 hours a day. And creativity is another thing, maybe a few more slides to share with you. I told you if you have hobbies, please continue the hobby. Every college has got organizations which encourage your hobbies. Fine arts and craft exhibitions are there, intercollegiate competitions are there. This Mysore Mallige could have been just thrown like that, but somebody used some creativity, put it, this looks so nice. So do the same thing a little way. This I always show, these are the two colleagues of my college. Wife was a cardiologist, husband is a neurologist. So on the marriage, she has put the tattoos instead of putting some funny things. So her husband's brain and spinal cord, her own department of heart. So nice, some creativity. So continue to develop or continue your hobbies you already have. Incidentally, I told you, in addition to my technical, being a doctor and an anatomist and a surgeon, I too have hobbies. Only thing, if you ask me, are you happy? I'm extremely happy, but for one thing. What is that one thing? Time. I always wish there were 48 hours per day instead of 24 hours. I could have done something more. Here you can do the time management. So I'm into music, I sing, I play instruments, harmonica, mandolin and guitar. Arts and crafts are a part of my profession in a way, because to be a doctor and a surgeon you need a lot of carpentry exercise, tailoring skills we need for repairing and stitching the skin. With due respect to your college, electronics and electrical is a small part of my hobby. Designing simple low cost medical equipment is the thing. I design small equipments. Carpentry, sculptures and carvings I do in my free time weekends. I write articles both in Kannada and English in different. I go to TV, radio. Probably funniest thing is cooking is my hobby. I do my own cooking. I'm involved in a lot of cooking competitions in the college. I take part in the competition not as a competitor, just to encourage the students. So these are the two dolls which I made when I was in final MBBS more than 40 years back, and I got actually first prize also. So be happy not only with your profession. I get involved in the cooking competition. I usually be a judge, and I also get involved in doing it. So all these things I'm sure it will be mouth watering for you. All these things I do. In case you drop into my house, I'm sure I can get some of the things. I do all these things. I enjoy doing it. I learn from my mother. Every day I do it. So how nice to go to different schools to give talks. Success is when your signature changes to autograph, and you are the architect of your future, right? Happiness is when you stop comparing, criticizing, complaining. They're all waste of time. You are great. Don't try to compare yourself. The one boy doesn't have hands, the other boy doesn't have the legs. They're still happy. We have everything, but still we try to be unhappy. So my good friend has
questions are there.
Yeah, maybe a few more slides. I will just finish it off. My good friend madam has finished telling about my thing, so I won't spend any time. Just less than a second. I was in receipt of a Government of India National Merit Scholarship. You'll be surprised that medical education is expensive. You need to spend lakhs together, crores together. Not at all. If you are good in your education, I did not spend even 1 rupee. I got the Government of India National Merit Scholarship throughout my BSc and MBBS days without spending any money. I completed my thing. Since I took something from the society, from the government, in my father's name, who was a doctor, veterinary doctor, I kept a gold medal to the student who scores highest in my subject of anatomy. This is going on since 25 years. Lot of awards, lot of felicitations, lot of these things is only to motivate you to do more. Responsibility increases. So all this have been told by my good friend here. you can achieve. This is only to show you that you are also a great person. You can achieve it. You should be able to say that today I did more than Shamsudra said. One fine day you should be able to do another webinar or a seminar, online or offline, and say that I have done something great. So always try to be there. I always wish you all the best in your future, and whenever you want to meet me, can always yes, this is an interesting thing. Behind every successful man there is a woman. It will not be the photo of next person, certainly not. Is my mother who motivated me, encouraged me, and 92 she expired 10 years back. We have donated her body has been plastinated. Even today I am able to see my mother after 10 years after she died. So this is her body, I am able to see in my department. So who is this? I do not know, you guess. Thank you so much for the patient listening. I am sure a few of my words are going to motivate you to become a great citizen. And my friend here says there are many questions which I should be able to.
Sir, so here some students are posed some questions. I will read.
Yes.
Jagdish
Yeah.
student is asking, sir, I am suffering from migraine from last 3 years. Can you please suggest me to overcome this?
Yes, migraine is a simple problem. It is a headache, very severe headache. I know you may say that the person who is suffering knows the difficulty. Migraine is definitely curable. One thing is, consult a good physician, a good doctor if you already have discussed with him. Most important thing I would suggest is, try to find out, search what is the one which triggers the migraine. That is the most important thing. A situation, a stress, a particular food, all these trigger. Identify that, discuss with your doctor, avoid that, 100% you are cured. It is a nuisance, I know, but what is the one which is triggering your migraine headache? If you identify and avoid that, it is 100% curable. And if you are around in Mysore, I can always help you in further analyzing it and getting the thing. And I always make a joke, don't think of the migraine. You think there is no migraine, it just disappears. Thinking about it causes stress and migraine increases. So you should be alright. Discuss with your doctor, and from my side I can help you out when you meet personally, probably. Any other questions, sir?
Sir, another question from Sharanu Hiraimat. What should we do if we are getting frequent headaches?
Yeah, I think the same answer will be holding good here also. Headache, in fact I have made a program in TV for nearly half an hour in Bangalore, Doordarshan, Chandana. Headache was the topic. In the beginning the anchor asked me, doctor, you have explained what is headache. What are the causes of headache? I told him, he gave me only half an hour. There are at least 100 causes for headache. He said, oh, we never knew about it. But none of them are very serious, of which maybe less than a dozen are serious causes of headache. Other things are small ones. So most important thing, headache is not a disease, it's only a symptom, it's only an alarm. We won't bother about the alarm in our house, isn't it? Alarm only indicates something is, somebody is coming in or something is wrong. So in the same way, any pain or headache or anything is only alarm saying that there is something wrong somewhere. So try to find out the cause, solve the problem, headache just disappears. To give one or two examples, you have got a common cold, you got a sinusitis, you got a bad tooth, you got an eye problem, you got an ear problem, you got even a gastritis in the stomach. All these can cause headaches. So there is no meaning in taking a painkiller for the headache, it may even increase it. Rather, try to find out the cause. Take an antacid tablet for the gastritis, change the food habits, avoid smoking, avoid drinking, avoid spicy food, avoid coffee, tea or whatever increases the gastritis. Next minute headache goes off. So headache is only a alarm or a symptom which tells you there is something wrong somewhere else. Try to find out and the headache is gone. So like this, instead of just taking self-medication, which is dangerous, consult a doctor. Very clearly, without any hesitation, you tell whatever complaints you have. Never, they say with doctors and police, forget about police, you can tell a lie. With doctors, never tell a lie, because we are there to help you out. Whatever is there, you tell it out. clearly we will try to solve the problem. You are going to be solved.
Sir, one more.
Yeah.
Madan E. student is telling, sir, I am suffering from juvenile arthritis from last 3 years.
Arthritis, yes.
Yes.
Juvenile means childhood, right from the childhood days, few years till maybe adolescent. Some children have some problems. Arthritis only means joint pain, the pain in the joints. So we have a few blood tests. What is the cause? Again, as I told you, arthritis means a pain in the joint. Telling us there is something wrong either in the joint or secondary to some other associated disease. A diabetes can cause arthritis. Changes in the food habits can cause arthritis. Overweight can cause arthritis. There are 1 dozen reasons. So, assessing the cause for arthritis, solving that problem, automatically the joint problem comes down. Of course, locally we give medicines to decrease the pain in the joint and it gets cured. So, consult a good orthopedic surgeon. Nowadays we got specialty also, pediatric orthopedics also. He will assess you. He will try to find out what could be the reason for joint pains and when it increases, when it decreases, with what medicine, all those things. Once all this is solved out and a good treatment for the cause is going to definitely decrease your juvenile arthritis.
Sir, Muhammad Aftab Ahmad student
Yes.
is asking, sir, I am suffering from sciatica nerve pain.
Sciatica
Nerve pain, yes.
Being engineering students, I can just give a little similar example. One of the tube light or fan is not working. My friends here, all of them are great engineers, that too in the electrical department. Since I know little electrical things, I dare to give an example of their department with due respects to them. When that particular last tube light or fan is not working, they know how to trace it. They try to find out the path of that particular wire. They found it in one of the joints or one of the bends or one of the places. Something has gone wrong during the repair or something. That wire is cut or wire is damaged or short circuited. The last fan or tubeless is not working. Exactly in the similar way, the nerves are like electrical wires in our body. From the brain and spinal cord, they go to every part. They bring information to the brain regarding the different aspects, and they carry information to the muscles and different organs. So particularly the sciatica means from the low back, the spinal cord, from the brain, the information is going to the legs, lower part of the abdomen and legs. And when this information is not going in the healthy way, something is pressing the nerves, something is pressing the spinal cord, naturally there will be disturbance. The person feels the pain in the region where it begins, and any movements are going to increase it, dragging sensation in the muscles become weaker. So we have the simple X-rays and CT scans. Definitely we know there is a point where there is a little problem. Maybe some good exercises. Now we got a good, very good physiotherapy exercises. He very specifically tells these are the exercises needed for this particular degree or this particular type of sciatica. And there are drugs which decrease the pressure symptoms, and occasionally they can also be tumor pressing upon the spinal cord or the nerves. A neurosurgeon is going to take away the tumor, or there could be the intervertebral disc pressing upon the roots of the nerves. Once the main problem is solved, automatically the nerves stop crying, the pain decreases. So a good consultation with an orthopedic surgeon or a spine surgeon is going to get cured. And of course there is a need for good exercise by a physiotherapist.
Sir, this is one Pritham Abhi student. What is the average weight of a 6 feet adult of 18 years?
Let's not bother about too much mathematics, because I am not a mathematics person, I am a biology person. To put it in a simple language, you want to uneducate a person, a villager, I will put it in this. Of course, few kgs this side, that side is always tolerable. You convert that 6 feet. I can always ask my good friend here, how much is the inches of 6 feet? In inches, how much is it? 6. My mathematics says is 72.
Correct.
If I can convert 72 into centimeters,
Inches.
that means height in centimeters. Can I put it in way? Let's say some 180, let us say, I don't know the mathematics, 180 centimeters, right? So measure your height, stand against a wall, take a tape, instead of inches converting. Of course, you people can do mathematics better than me. So I go to scale of centimeters, I measure it. For example, my height, let us say 167 centimeters, let us say. Simple calculation is minus 100 or chop out that number 1, simple. 67 number weight. Your maximum weight shall be 67 kg. My maximum weight shall be 67 kgs. Lower the better, because too low is bad. So my good friend, Mr. Muhammad, if I am right, 6 feet, he can calculate on his own. Some of them can calculate with fingers, with whatever knowledge of mathematics. So remove that number 1 or minus 100. So there should be the maximum weight for him, an average. 5 kg less is always safer.
Correct.
5% above this, 160. My weight ranges between 63 to 65. I'm still in the safer zone. If my weight increases by 5% of 167, maybe 170, I should be a little bothered. I'm going for overweight. If it increases by 10%, that means 66.7 kgs, 170, 73, 74, I'm really obese. So obesity is one of the innovations for diseases like diabetes or hypertension or overweight, joint problems, including depression, including muscular weaknesses and all that. So try to be lean and smart.
Sir,
Big is not always beautiful.
for connecting to this, student Preetham Hobby is asking, sir, I am going to gym. Is a healthy method to reduce the overweight? He is asking the question.
I do not know his weight anyway. Gym is a physical exercise, like a sports, like a jogging or a walking or a yogasana, whatever. All are physical exercises. Only any of these things are good enough, because everybody may not be able to go to gym. They can do in their house. Even a walking. Nowadays we see the youngsters. Opposite house there is a shop. To buy a small thing, they want a scooter or a car. This is the extreme of it. Whenever there is a possibility, walk. You have a good air, good physical. I told you in the middle. 2 systems in our body improve by usage. Pores may get eroded by usage. They grow. Skin gets eroded. Every second I do it like this, thousands of skin surface cells die, new cells are formed. But 2 tissues or 2 systems improve by usage. One is the muscular system by your physical exercises. Second one is the nervous system. More and more brain use, it improves. That's what Einstein brain says. So going to a gym or doing any physical exercise is excellent. Only thing is, after coming back from gym, do not have a huge meal with non-vegetarian, fatty, sweet and all that, saying that you have lost lot of weight, you have to recoup. No.
Correct.
A balanced diet, a good physical exercise. More than that, I would put one more thing, because a healthy mind, healthy body. As long as you maintain your mind healthy, your body will be healthy, right? That's most important. So think positive, have a positive attitude, try to maintain your health, try to share your experiences with others, have a good interpersonal relationship, you'll be great, right? Okay. So if everything is fine, thank you for the opportunity, thank you for patience hearing.
One more question, sir.
Yeah. Do we have time?
How to increase the weight?
Increase the weight. I do not know why.
It is fully contradictory.
Yeah. Unless the person has lost a lot of weight beyond normal, I would say, beyond physiological, I would rather congratulate that fellow who is less weight, because very easy to increase the weight. Within a couple of months, you can increase 10 kg to 20 kg.
Correct.
To decrease same 10 to 20 kg, 1 month, 2 months will not be enough, and
Correct,
even
sir.
it may take years together. Rather, I would say, be happy with low weight, unless it is a part of some disease.
Correct. Last question, sir.
Okay, sir.
Walking for a 1 kilometer is better than running 1 kilometer. Why, sir? He's asking.
Walking for 1 kilometer.
Better than running a 1 kilometer.
Walking slow, I don't think can be better than fast walking is necessary. Slowly walking, taking half an hour, I don't think would be better.
Correct.
Any form of physical exercise
Correct.
with a good intention, good mind, good physique is going to be there.
Yes.
But I repeat the last sentence: avoid junk food. Most important thing, which I am 40 years now as a doctor. I see lot of children, lot of youngsters going to roadside food, lot of chemicals. One simple example is going to take you away from this what that reddish thing which I never eat, the mushroom, what do you call that? Can you believe some of the chemicals used are paints? They are the redoxide, which is a poisonous thing, right? So they use because they are cheaper. So try to avoid roadside food and be healthy both in mind and body. And whenever necessary, you can always contact me. I'll be very happy to share. But Sarve Jano Sukhina Bhavantu. Be happy. Thank you so much for the opportunity. I thank NIE also for giving me.
Sir, we are very thankful to you because you are the busy scheduled. You are coming here and interacting the student along with your presentation. I hope all the students are enjoyed the full session of the Dr. Shamsundar sir from JSS Medical College, and I hope all the presentation entire period you are enjoyed, and make use of the doctor suggestions so that you will be fit and get set go for the next your coming academic years, and be healthy and be safe. Thank you, sir.
Thank you very much. Thank you very much again.
Okay, we will end of the today's session. So we will tomorrow is the Christmas holiday. We will come back on Saturday 10 o'clock first session. Okay, thank you.